Okay, fourth and final one of setting up the teeth, and this is positioning the lower anterior teeth. Can be a little bit tricky, this one. You're aiming to fill the gap now in between the premolars. So there's often a lot of chopping and changing between the size of the teeth. You can see these are number 7s, B2s, the shape.
They're special.
They are special. And you end up doing lots of funny things like leaving little spaces between teeth, or adding an extra central incisor in, or trying to take the distal off your canines or whatever to try and
lumps out of teeth.
Yeah, get them all to push into position.
We seem to end up grinding the lower anteriors, which are quite small anyway, and quite fiddly. So you're starting on the midline.
Yep.
It goes.
Most patients tend to want the midline of the upper and lowers to coincide. So most patients tend to like the centre lines coinciding, although in natural teeth they often don't. But it's one of the first things they notice if they don't. So if we have to squeeze in an extra incisor, they soon notice.
So you're going to shunt yours across a bit there, just wiggle him over.
Yeah, you never know whether it's going to work until you get the final one in. So we're just looking at getting a millimetre of overjet and overbite on these, so that when we go into a protrusive excursion or a lateral excursion, they'll contact with the upper teeth correctly. So the patient will be able to bite the fingernails as normal. If they didn't, they'd have a gap at the front and they'd be useless with cucumber sandwiches.
Yeah, you get all the bread and no cucumber. Okay, looking good.
Just
So this is where they're very light. They do seem to not stick down very well, so you have to get quite delicately with the knife here. And the pin always seems to be in the wrong place.
Of course.
Yeah.
So faffing about with these a bit.
This is usually where I burn my finger, because you're holding the teeth and poking it with a knife. So.
So that's the 2 incisors just about right. With these two, you keep them vertical.
Yeah. And they are asymmetric, aren't they? Unlike the 2s, which are more fan-shaped.
That's right, yeah.
So and it's very easy to muddle them up if you put them all down on the table. So
yeah, best to keep them on the card.
Keep them on
if
the
it's
card.
just the first time, you're not very good at spotting the difference. You saw just there, we went into the lateral excursion and we were just looking for that lateral lower incisor to contact with the upper lateral incisor. Didn't quite, so I just tweaked it up a bit. I'm going to get the other one in before we carry on much further. Sometimes you best just get them in and let the wax cool down a little bit and then just adjust them once they're in place.
And you're looking quite handy for the canines to fit quite nicely this time round, aren't you?
Yeah, it all seems to be working out a little bit too well.
Yeah, here we go then, this is the moment of truth.
Again with the lower canine, but a bit like the upper, you want it nice and vertical. Sometimes you tend to be tilting them just to get them to make up the space or to fit in the gap. Hopefully you want them.
You practiced before you did this one, didn't you?
You would have thought so, wouldn't you? But chances of that just worked out perfectly.
Excellent. Oh, yeah.
Just
you could see it, but it looks good, yeah.
You'll see it again in a minute, I think. Just lifting that up a bit so we get the contact when we're going laterally. Last tooth then in the arch. Okay, just dropping in.
From experience, you're making this look annoyingly easy.
Yeah. It did go well, this one.
Yeah.
I was quite surprised. into the excursions now. Now you can see how we're contacting there. It was just a little bit light on the anterior, so we're just going to tweak them up a little bit. There's always a lot of fiddling at this stage just to get things lined up nicely, make sure the gaps even in between them and that they're rotated to the right angle, and it's one of those things that you can go on doing forever really.
Yeah, it's quite relaxing to do. You can sit there and fiddle away with the teeth.
Okay, still a bit light on those anteriors there, something just pulling it away, but that's not bad for a try-in really. See the centrals we're contacting, we went into the protrusive excursion there. So just having that canine up a little bit more. Just to try and create the contact. The problem is if you only have contacts on one or two teeth, is that the lower denture tends to flick up because all the load's going onto that part of the denture. So you're trying to make the contacts as even as possible over as many teeth as possible. Okay, so now I'm just going to go around and sort the waxwork out around all those teeth, and in the next podcast you'll see us waxing it up and contouring. So that's it, job done.
Excellent.